I'm Mariko Masujima from Chiba University, and I'm very happy to be here today and talk to you about interdisciplinary palliative care research, the development of a web-based end-of-life care educational tool for the elderly. So you may feel sleepy after lunch. Unfortunately, I'm good at speaking Japanese, not English. But I will try my best to keep all of you awake during my presentation. Okay. And this chart shows the location of Chiba University. Chiba Prefecture, where Chiba University is located, is just next to Tokyo. By the way, this red dog is Mr. Chiba-kun. And as you can see from the side, he looks like Chiba Prefecture. And he is the prefecture's official mascot and is widely popular. And next, our university has 10 undergraduate and 13 graduate schools, including medicine, pharmaceutical sciences, and also a university hospital. Therefore, we are in an environment where palliative care research can be oriented with the diversity of disciplines, and research can easily collaborate. In this presentation, I will introduce you the current situation of end-of-life care in Japan. I will talk about the web-based end-of-life care educational tool that we developed to support both the elderly and their caregivers. This hopefully will provide you with an understanding of how we are working towards creating interdisciplinary palliative care research in Japan. At first, this chart shows the leading causes of death in Japan in terms of the death rate from 1947 to 2017. The current main cause of death in Japan is cancer, followed by heart diseases, cerebral vascular disease, and senility due to a natural cause. Senility is increasing significantly and recently overtook pneumonia. Cancer has been the leading cause of death since 1981 and is responsible for about 30% of all deaths in Japan. However, consequently, palliative care is mostly associated to cancer care by Japanese people. However, in this rapidly aging society, the advancement and expansion of end-of-life care in Japan should not only be focused on cancer patients, but also on elderly people with all other conditions, such as chronic diseases or dementia. Next chart. Currently, 12% of people die at home, and 80% in acute care hospitals, despite 70% of them preferring to die at home. There is a big difference between the preferences of the patient and reality. Due to the ever-increasing costs of healthcare in Japan, the government wants to shift the focus from hospital care to community care. However, the reason why there are a lot of hospital deaths is that many patients and families mostly wish to receive medical treatment until the very end. For instance, the patient or family sometimes get angry. Why don't you do an infusion? Even though it is difficult to cure or becomes a disadvantage for patients. These are caused by lack of communication between patients, their family members, and healthcare professionals. Since patients and their family hardly discuss end-of-life care, they tend to mistime the shift to home care. Therefore, we have developed the web-based end-of-life care educational tool for them to encourage public awareness of advanced care planning. Now, I'd like to move on to the overview of and outcomes of our research. The purpose of our large project is to aim at realizing end-of-life care to support the elderly in order to live fulfilling lives and to establish a center of excellence for end-of-life care in cooperation with the public and professionals in an aging society. As for the Center for End-of-Life Care, these specialized centers seem to be established in some facilities, such as All Ireland Institute of Hospice and Palliative Care, or some universities in Europe, but there is no such center in Japan. To accomplish the aims, we are divided into 4 groups called AIDED. Group A, Advanced Care Planning Research Group, Group G, Global Research Group, Group E, Educational and Learning Research Group, and Group D, Development of Practice Research Group. So in Group A, a prototype for a web-based educational tool has been developed by using ICTs. And thanks to the diversity and strengths of our universities, as you can see in this slide, our interdisciplinary research team consisted of 30 researchers from 9 areas, including nursing, medicine, engineering, horticulture, health economics and policy, theology, ethics, philosophy and law, and politics. The research member in Group A consisted of nursing, medicine, engineering, and philosophy of law researchers. And this slide shows the phases of development of and implementation of ICT communication tool. We have been working on a research project utilizing grants of over 260,000 euro from the Japanese government since 2015. In the first phase, the ICT communication prototype tool was developed by 4 nursing researchers and 1 engineering researcher. Afterwards, it was modified to reflect the results of a feasibility study for the public and the professionals. For the public, 10 participants used this tool for 1 month, and for the professionals, 6 expert nurses and 6 researchers, nursing, engineering, and medicine, were involved. In next slide, I will show you the first phase of the research to develop a prototype version 1. Regarding the development process, this tool has 5 components to think about advanced care planning from the objective point of view to subjective point of view. And I will show you the actual screen on this tool. When you click My Wishes tab, the following screen appears. You can see 5 components. First, end-of-life simulated experience program. Second, thoughts about EOL vignette. And third, which is about tooth-telling. And fourth, end-of-life care preferences, including advanced directive. And last one, my favorite thing in life. And the below, diary tab, a diary function is also available in this tool. It would be suitable for people who like to keep a diary. If they don't like writing, they can upload photos that they took with a smartphone. In other words, we can find out what the person is interested in from the photos without having to maintain a diary. In this presentation, I will demonstrate an end-of-life simulated experience tab. When you click it, 4 types scenarios or discussions will appear, like at the very top of this page. When you click case 1, if your husband with COPD has become worse and fell into unconsciousness, you can select the best actions to take in this virtual case. Firstly, when you start the virtual case, there is a background of married couple in their 80s shown on the screen. On the next slide, the husband fell down suddenly with discomfort and loss of consciousness and is transported to a hospital by ambulance, where the physician or clinician is informing his wife about his treatment. While his wife is being pressed by the physician to make a decision for the emergency medical treatment, she tries hard to recall his preferences. Then she remembered he said to her and their families that he doesn't want to any unnecessary treatment. From there, the user will decide on the treatment from the point of view of his wife. And pattern A, you agree with the medical treatment. Or pattern B, as from his will, I talked to the physician that he doesn't wish for anything more than this. If you choose pattern A, a couple of results will be displayed as shown on the next slide. Consequence 1, later on, the husband regained consciousness and said to his wife that it was the right decision to get medical treatment. Consequence 2, after he regained consciousness, he said to his wife, "Why didn't you just let me pass away without any treatment?" Their scenarios are real story in Japan based on our previous research interviews to healthcare professionals who were working at hospital or hospice and palliative care unit. The consequence of death to yourself or your family is unpredictable, and you can never fully guess the outcome. However, the healthy users at this very moment can theorize what might happen at the end of your life as you experience several simulated cases and write down how you feel from simulating these situations beforehand. So far, I have shown actual screens of this tool. Now, I will introduce the results of the usability study for the public who used this tool for 1 month. This study was presented at the Advanced Care Planning International Conference last March in Rotterdam. The purpose was to evaluate the communication tool's usability and whether the tool encouraged the initiation of advanced care planning for a sample of community-dwelling adults. Data was collected from the entries on this tool website, a self-reported questionnaire, and a semi-structured interview to evaluate acceptability, demand, and practicality after 1 month of using. As for the results, Table 1 shows the demographic data. 7 participants out of 10 were over 65 years old, and 6 participants only used a tablet computer. Table 2 shows the achievement rate of each completed tool component. As you can see, the highest achievement rate was the end-of-life care preferences, followed by the wishes about truth-telling. The lowest rate was the end-of-life simulated experience program at 45.6%. Finally, I'm going to explain Table 3. 4 themes related to the views of the tool usability were found by the thematic analysis. The first theme, understanding of advanced care planning, included that we would like to think about advanced care planning while I'm still healthy. In addition, one participant aged 84 used this tool with her daughter, and her daughter said, "Using this tool together with my aging mother, who isn't used to using tablet, made me realize for the first time what my mother was thinking about." Most of the participants realized the necessity of advanced care planning education for themselves and their families. However, we need to address that a few participants felt disadvantages by using this tool, such as the last comment, "Since I write confidential and personal matters that are difficult to explain to others, I'm concerned about the security of this tool." So in future research, I'd like to improve the tool so that it will become more user-friendly and have higher security, and then develop nursing intervention with this tool for the usage of a large number of the elderly. Finally, I will explain working towards creating interdisciplinary research. In the third phase, we are developing a nursing program using the ICT tool version 2. During our past research process, I realized some of the strengths of being on an interdisciplinary research team. In developing this tool, an engineering researcher has made technical improvements to make this tool more user-friendly. In the future, we plan to work on RCT research as well, so a medical researcher who is an expert in geriatric medicine and clinical research will be involved in protocol development of RCT. In addition, philosophy of law researcher has been involved in providing a perspective on bioethics that is important for patients and their families to consider end-of-life care. Takayuki is a philosophy of law researcher. He has contributed to palliative care research by providing normative advice from the perspective of ethics, law, and morality. It is very difficult to explain the Greek ethos of liberal arts to natural scientists. As a consequence, conversation with natural scientists facilitates the evolution of liberal arts. For instance, he usually asked us philosophical questions from the book Mortal Questions by Thomas Nagel, who is a famous philosopher. Questions are, is my life and death only mine? What is a good or a bad death? Or which is worse, the death of an elderly person or that of a child? We healthcare professionals are unlikely to contemplate this. This is what gives us a perspective on death itself, which is usually difficult to think about when providing care. We needed interdisciplinary conversation much more. He said, I won't mitigate the mutual misunderstandings and mistrust between natural sciences and liberal arts. And nursing researchers didn't often collaborate with researchers in other academic fields in Japan, even though we belong to the same university. In recent 5 years, our university has facilitated to strengthen research by younger researchers and to ensure diversity. Our end-of-life care large project has been selected as a next-generation priority research by our university and got the funds from university. So we could collaborate with diversity researchers. And our university has also the Department of Academic Industry Collaboration called AIC. Thanks to this department, in addition to the end-of-life project, I'm collaborating with other engineering professors on research related to lymphoedema that often develops in advanced cancer patients. The staff in AIC who had graduated from the Faculty of Engineering requested me to talk about research seeds in nursing at a technology seeds presentation meeting with local companies about 5 years ago. In that meeting, I explained the necessity to develop a simpler device that can detect early stage of lymphoedema. After my presentation, they introduced me to one professor who is an expert in fluid mechanics and studies blood flow in our university's Faculty of Engineering. At this time, 20 researchers affiliated with nursing, engineering, and medicine at Chiba University are being connected by AIC with their shared interest in lymphoedema. Since then, the joint development of new equipment has been continuing as shown in the following slides. This device is water content imaging by wearable sensor using the principle of bioimpedance. Ultimately, we aim to capture the data collected by the developed device and load them into AI. This enables the patient to easily monitor the condition of their own limbs at home through a smartphone. This is the last slide. As I mentioned above, I think that I was able to collaborate with engineering and other researchers because there was a human resource who could connect the university system and the strengths of the researchers. In order to do so, it is important to clarify the research seeds required for well-being of patients and families from the nursing standpoint, and to understand and share the strengths of them in other disciplines, creating an interdisciplinary research team. And I think it is important to function well. That's all. Thank you very much.